Welcome to Seasoned Women Podcast, the podcast that is raw, real, and uncut. No topic is off limits. Seasoned Women, we're going to make this make sense. I'm just saying. My name is Mary Dean, and I am the host of Seasoned Women and the queen of all seasons. My guests today are Jody Guiford and Debbie Jackson, two people near and dear to my heart. Welcome, Jody and Debbie, to Seasoned Women.
Thank you.
Thank you.
You're welcome. Both Jody, I'm just a little information. Both Debbie and Jody are foster care providers in Kansas, and they are working to address challenges associated with children in the system. So I want to start off with you, Debbie, the lady of the hour here. And give us a little information about yourself and what made you decide to become a foster care provider?
You talking to me?
Yes.
Mine's
yeah. Don.
Well, I actually got encouraged by a good friend of mine. She was doing foster care. And I always played around with her kids when I got my hair done. And she just encouraged me to need more homes. And I'm like, oh, no, I don't know about that. And she's like, you'll be good. They need a lot of it's got a good heart, and you get along with the kids anyway. I was asking for you. So it took me a couple years to actually gravitate towards it or whatever. And as I started out with the smaller kids, and it's just too emotional dealing with the smaller kids because, it's you just can't tell the kids, hey, you're not going to see your parents anymore, So I kind of got out the smaller kids and went into more teenagers. I can deal with, them, they verbal. They just going to let you know how they feel. So I can deal with them verbalizing instead of being so emotional about everything. So I've been doing it for about 10 years. I really enjoy it. It has its perks. It has its downfall. It has the stress of dealing with, other people's children that is not of your background. It's really hard at times to break those barriers, but you just have to really focus on just the way you do things and how you do it. But like I said, as I got more and more into this, I just decided what I needed for my home and what I didn't need in my home when it came to these kids, because you just can't take in and every kid. Like, I don't know if Jody could say this too. You just love kids. It doesn't matter what kind of kid comes in your home. Like I said, when I got started, I know all this. If I had known all of this before I started, would I be probably doing it? No. If I knew all this stuff that I was going to go through, I probably would have did.
Yeah.
I started.
Yeah. And you, Jody?
So how I got into foster care is my mom used to do it in the late 80s. And so I've just always I took care of my little brothers. My mom adopted two kiddos when they were young, and she raised them, and I used to have them all the time. And foster care kind of never did cross my mind when I was coming up, but I got married when I was young. I had to take care of my own children when I divorced when me and my wife got a divorce, and so it's just something that I've always done. I mean, I was a young teenage parent, plus I took care of my little brothers. And so it was something that I've always been interested in, but Deb kind of pushed me. We talked about it, and she's like, bro, you'll be good with kids, you need to, And so she kind of led me through the process and how you go about doing it and stuff like that. And so I've actually worked in a couple of group homes. I won't say their names, but I worked in a couple of group homes, and I kind of seen how that worked out. And some of it was good, some of it was not so good. However, you know, you learn from other people's mistakes and you just build off of that. And so when I started doing foster care, I've been a foster parent almost 4 years now, and
Mm.
I just believe in. I've always been fond of 14 to 18 because, especially young men, because they're about to go out here and hit the real world, and uh, sometimes they get into a little trouble, but before they get out there, you can kind of guide them. You can kind of guide them and try to help them before they actually get into trouble, because some of these kids come in here at 14 and they've been in trouble already. So what you're trying to do is trying to figure out how you can best help them.
Yeah. And I have to say that both of you do a very good job in doing what you do. You really have. I've seen it firsthand for myself. I want to ask
Thank
you
you.
a couple. Yeah, I want to ask you a couple of several questions. How does the foster care system work in Kansas? And by that I mean, what is the foster care system meant to do?
Okay, the on my perspective of it is we're kids normally come into care because of neglect, abuse, or the parents just cannot handle the child, maybe getting in a lot of trouble or a lot of truancy at school. So that may be a case why they're in foster care. But once they come into the system, what they do is they try to match you up, match the child up with the home, with a foster home that, when I say fulfill, is that when we agency, we go through a checklist of things we would accept or take in our home, such as if, like, one of the questions is there a gang member? Would you take a gang member in your home? I mean, I said that because I want you to know what kind of serious question they ask. And you can mark yes and no. So what they do, they put it all that together. So when they're looking at the kid, they try to put the kid that match your home, your profile. So we have a profile, so do the kids,
Okay.
you know. So once they match you up, they'll do, would you like this kid? You are matching, you can review the kid's profile. And once you review it, you say, hey, yes, I would like to take that kid, but you take the kid on a trial base. It's called a PPV, trial base. And
We lost Debbie for a second.
Okay.
Yeah. Well,
Okay.
well, she'll
Okay.
be
So
coming back. So just Jody, can you pick up where she kind of
yeah,
left off?
I can kind of elaborate a little bit on. So what ends up happening is you take your kid on a PPV. It's called what is it? Pre placement visit. And so what ends up happening when you do a PPV, you kind of see how you and the kid that can connect with each other. And see, I never ask the kid if they want to stay in my home on a PPV visit. I always let the kid select me. Like, they go back and they say, hey, talk to their case team, and they say, hey, look, I want to stay with Mr. G because I like him. I like, you know, I'm real structured. I have a structured setting that I do every day. And we take showers at a certain time. We eat at a certain time. I mean, you know, unless we're out or something like that, we, I get, if they on meds, they take meds at a certain time. Um, and we do activities or whatever. So it's a structured basis. And some kids don't like that. Some kids do like it, and I want to be able to help any kid that comes through through my house, because I believe that it's not a coincidence that a kid gets sent to your house. I believe that God sent them here for me to help them if they allow me to help. So
Yes.
that's how I look at foster care. If they allow me to help them, I will help them. If they don't, then hey, I can't help anybody that doesn't want my help. So we have to find you to go somewhere else, another home or something that may be able to help you
Yeah.
and help your needs.
Okay. Debbie, before you got cut off or disconnected, what is the structure that you have when it comes to the young ladies that come into your home?
Okay, mine's a little bit different because I'm a therapeutic home. So what I do is I do a lot of observation. I normally when I do my PPVs, they like for you to do at least 2 days, but I do 5 because you can't really figure kids out or where they're going to fit in 2 days. So 5 days, and then question, I listen to them, and I try to get kids that are different, that have different things going on, because you don't want kids with the same things going on. Then you have a whole lot of going on here if you get the same. I never give them my rules. I don't get no rules, and they pretty much have to learn through the other children. Okay, they always, if you don't understand something, ask me. That's how I do it, because I allow them to be who they are, so I can figure out what do I need to do with you and help you on. And then after about 30 days of them being here and I'm observed them, they don't know they're being observed. They don't have no idea that I'm watching their movement, their power, because everybody got a pattern. So once I learn about them, then I start implementing different rules in, because I'm getting kids that are intensive kids, and Jody does too. And sometimes they so used to all these rules at the beginning that they don't want to stay, or they're going to have this wall up. So I try to build on that relationship of, hey, the trust, the love. I try to pour all that in first before I actually start to discipline or take things away, or or implement different rules. That some things don't work with every kid, and each
Right.
kid the same.
Yeah. Deb, you
So
got a
I,
delay for some reason.
huh?
You got a delay for some reason.
No, it's my Wi-Fi, honey.
Oh,
It's
okay.
yeah,
Okay.
low Wi-Fi.
That's all right. That's all right. Okay.
The modem.
Uh,
Anyway,
uh,
but I that's how I operate, because I used to do that and it didn't work for me. It works for Jody because, to put all his rules out, because he's a man. Okay.
mm,
I'm a woman, so we have to be a little bit more softer, and research, because I want you to feel like you live here. I don't have a facility, and I'll have more children than Jody, so the structure is easier for him than me. I don't like to micromanage. I don't. I want everybody to feel when they come here, this is a home. This is not a group home. This is not, and I tell them, this is not a foster home. This is your home. The only thing that is a foster to me is that license.
mm.
Here, you get a clean slate, no matter what's in your referral. Ms. Debbie give you a clean slate until I start writing on it. When I start writing on it, and we deal with those issues. I can't deal with things that
Happen in the past.
happen.
Right, right,
So I
right.
have to put it now. And a lot of kids are not used to that. They know that they did a lot of things. So, and they think that you're gonna hold everything everybody said about them.
Yeah. Yeah.
That's
Yeah.
true.
Yeah. Well, okay. So where do most foster kids end up? Most kids, according to Health and Human Services, supposedly what they said, they're reunited with their parents and other members of the family. Is that true? Is that really true? Do they end up with their parents or
It
another
just
family member?
it just all depends on the whole situation. I mean, you have kids that start out, doing visits, and somehow or another, the family falls off. It could be drug related. It could be no transportation. It could be they're frustrated. I mean, it could be the system that's set up for them to go through all these classes,
Mm,
and it's a lot that goes on. I mean, because every kid comes in here different. I do know they make you every. I know every kid in care, they make them take the foster care classes, but I don't know how intense or anything like that they are. But I know it's a lot of classes that you got to take. Some people got to take drug tests. I mean, and if they don't pass their drug test, and they end up terminating the kids, the parent child rights. I mean, to that kid, and so
mm,
which is something that the foster parent has to deal with, because now they knowing they might get real aggressive or hostile with you, or talk crazy to you, because their mother or father is not living up to their responsibility as far as getting them. So I mean, it's a lot of different things determine on how they integrate back into their homes. I only had one kid in the 4 years that I've done it. I had one kid that integrated back to his home. Two, no, one. I had one kid that integrated back to his home, and then he was there for a month, and then he was back in my home, and
mm.
then he just aged out. So I mean, uh, I don't know the percentages. I don't know, because I only had one, and I probably done foster probably about 15 to 20 kids. So I only had one, so it's a low percentage for sure.
Yeah,
Just in my home, yeah.
yeah. What about you,
Now,
Deb?
now that's, I think I've only had one kid too out of all the kids come through here. So there's only one kid that actually went home, and she really didn't want to go home. And I took her back home. We drove the 3 hours to take her back home. I wanted her to go back home from me, not from transportation. So, and when I went to see exactly how this child was going to live, in my heart, just like, you really don't know where they actually come from. You see it on the papers, but you really don't know. And I didn't understand why she didn't want to go home, because she wasn't going to get paid attention to like I pay attention to her. So, and she voiced that, I'm not going to get everything. You make sure I have everything. They don't care. So you
Mm,
deal with a lot of that. But as far as they make it, like Jody said, they make it so difficult for these parents to redeem themselves as parents. You want me to have a job. You want me to go to these classes. I can't, I have no car. I think if they find a budget to help these parents with transportation, not a bus card, help them find a car so they can get around to these jobs that they want them to have, because 9 out of 10 these parents don't have the resources to be a good parent.
yeah,
Instead of just taking the kids and keeping them in the system for a year, use some of that money to help them be better parents and efficient parents. And
mm,
it's sad, because I be trying to help or whatever. I even help some of my parents, like whatever I can, like I haven't told Jody yet that sponsor a parent, one of the kids' parents, for Thanksgiving. Get them something, get them some food or whatever, let them know, hey, I have your kid, but, don't you give up. Don't give up
Wow.
on your, just to make
yeah,
it hard. Don't give up.
yeah.
And
They
don't
would
want.
need encouragement. These
Yeah,
parents, these parents need encouragement, especially when your child is in the system and you have limited time and choices to visit and all that. So, and the court system is not an encourager at all.
Right. They there to discipline the parent to get the parent right, but however, it's sometimes it backfires on them because they can't do what the courts want them to do.
Right.
So I mean, it's you kind of damned if you do and damned if you don't. If you, I mean, and then like I mean, just we see, like so Debbie was talking about how they have to have a job, they have to have a car, they got to have a place to stay, they got to have beds, they got to have drawers, chest of drawers in there for the kid when the kid returns home. They have to have all these different things for the kid to return home, and they don't have the money to do it. I mean, if you barely making it, I mean, where you going to get all this stuff at? I
Right.
mean, and
Yeah.
so just providing a roof over your head is a lot. And then they have the beds and the clothing and the
Mm.
food and everything. It's just a lot to ask these parents that haven't been able to maintain employment, a car, or whatever, whatever they're lacking.
That's a sad situation.
Yeah.
So, what does a person really need to know if they're thinking about becoming a foster care provider? What do they need to know before they even cross that, dot that I and cross that T with uh, whoever has been contracted to do foster care? What do they need to know, Debbie?
well, they need to know a little bit more than what they teach you when you first come in, because they do scenario that you go by, but they're not they're not this era. Them are old scenarios. They need to know exactly what you're getting yourself into, because we're dealing with a lot of mental health, because they didn't mainstream so the mental health. They mainstream um, juvenile children into our home, and they also have mainstream children that are defiant and have truancy, and just expect us to do different than what the parents are doing. And now one minute you a foster parent, one next minute you a detention officer.
Mm.
You are you might be a clinic. I mean, you look around. I mean, that
You're a
we
counselor? Yeah.
counselor, a therapist,
Yeah.
a
Yeah.
you wear so many hats, and every day you don't
Right.
even know. And then when you get to the bottom of, they don't put everything in those referral. A lot of things are just you learn as you go,
Mm.
and it really makes me mad. Sometimes you don't even know that the child has any charges, any charges, that they've been in trouble, and all of a sudden you get a probation officer calls you for the kid, or they show up
Mm.
at your house, and you're like, okay, well, what? So they leave all them things out. Those things are valuable to us because we need to know what we're dealing with,
Right.
and they hide
Right.
things.
Yeah.
So your heart is come in, and try to figure out how to help them. You can't say, well, you know what, you got this guy, you got this going on. Well, I said I take these type of kids, but well, you're doing so well with them, Dad. And you like, but good at night, So I just
Yeah.
see a mental health institution, but
Right.
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 I and you just got to roll with the punches. It's like,
Mm.
okay, you love this kid. Let me see if I can exhaust everything I possibly can to do for you. And once I can't do it anymore, it's okay to let you go, because I can't stress myself too much. I'm gonna do what I can, but we are dealing with a lot of mental health. And that they don't want to diagnose a lot of these kids with mental health issues. Everything they say is trauma. This is not all trauma.
Okay.
Okay. Mental health.
Okay.
And we don't get the training, enough training for mental health. And we need to be able to identify that.
Okay. That sounds, Jody, and you, what is your take on that?
So I agree with Debbie. A lot of kids that we run into have a lot of mental health problems, and uh, there's a couple of kids that like I won't take in here, like uh, they call them I'm trying to think of the word
SO.
yeah, SO. I won't take the SOs in my house, and that's sex offenders, because I'm around my kids, I'm around these kids, and I don't want anything to happen to my family or any kid that I'm fostering, And so me personally, I cannot, regardless of if I can help that kid or not, I just can't find it in my heart to take those, because I have other kids involved and my family. And so it's tough for me uh, to turn down. However, it's safer for me to turn it down than allow something to happen to my family or to another kiddo in the household. And that's what Debbie was talking about. The referrals, sometimes the referrals don't have that on there because they're just trying to get the kid into a home. And what ends up happening is another kid, if you take those types of kids, if you don't even know that they's a type of kids, and something happens in your home, you're going to feel bad about it. So I don't want to feel bad about it, so I don't do it. I mean, so you just have to be careful and read the referrals and ask questions on the referrals. Like, some of the stuff is 2 years old, some of the stuff is a month or 2 months, or so you have to really pay attention to your paperwork to make sure. And if you see something that you don't like, you say, oh no, I need you to find out more information. So you call the agency, and they supposed to find out the information for you.
Okay.
So
All right. Wow. That's a lot to think about. Really. Based on
right.
what you and Deb said, that's a whole lot to think about.
Right,
So,
right.
you know, so it sounds like there are some disadvantages of being a foster care provider. And it sounds like the referrals and not getting all the information that you need is one of those disadvantages. Am I correct? That's
Correct.
what it sounds like. I mean, when should they be updating the information on these children? Should it be done on a monthly basis or quarter? I mean, when should the information be updated in order for the foster care provider to understand who they're dealing with?
They're
Well,
supposed to be monthly.
I think they don't really update it like that unless they leave their home. They really don't. They only update when they leave the home. From my understanding, I may be wrong, but you pretty much just get a little bit of why they're no longer in that home or that placement, or they give you a little information about that. But the one thing that I always ask for, because of the type of girls I take, I ask, have they had a psych evaluation done on them? And a lot of people don't like for me to ask that, because I want to get down to the nitty gritty of what's going on with this kid. And if you are a tense kid, I think that every kid that are tense like that should have a psych evaluation done. That's going to determine where you at mentally, socially, everything, your IQ and all that. So, and a lot of people don't know that you can, as a foster parent, ask and request them to do that. Do they like to do it? 9 out of 10, they say, oh no, whatever, But if you get it done, it'll help you service a child better, or determine can I keep this kid in my home? Can I really help this? It has all this stuff on there that you need to know about a kid. So, it's just one of those things, Mary. I don't understand why some of these things are just not put in place to better
Yeah.
foster.
I noticed that you and Jody both, your homes welcome children that have disabilities. And are they more in need of more services than the child that maybe has a juvenile delinquent problem?
So with me, I mean, the child with the juvenile problem, let me just it depends on what the problem is. I mean, if they robbing and stealing or smoking weed or whatever like that, you're not you're gonna have to really be on guard with that kiddo. If they're a runner, if they, you know, if they just defiant, if they're a defiant kid, a juvenile child, most of these special needs kids, they are very appreciative of what you do for them. And I find it not harder, I find it easier actually because of they want you to help them. They want you to help them. The juvenile, he want to get away with stuff. He want to challenge you. He wants uh to see what you're gonna do. And and we can only do so much. I mean, if they uh want to fight or something like that, we can only call the police. If they run away, we can only call the police on these kids. It's nothing that we can do. But my experience with special needs kids, they're not trying to fight you. They just want genuine love. They want somebody
Yeah.
to care about them. They want somebody to be consistent with them. They want somebody to tell them what they need, that they're doing wrong. They want somebody to, talk to. They want somebody to love on. And it's just easier to manage in your household because you don't have all the chaos that you would if you had the juvenile child in your home.
Yeah.
Let me just say it like that.
Yeah. And
Yes, and you, I'm sorry. I
go
would
ahead.
add,
Go ahead.
you really appreciate because they show you all this affection and love, and like Jody said, you don't have a whole lot of behaviors out of them. They really are more humble. They may go to school and do their little stuff or whatever, but at do a big, let me say, okay, mine do big stuff at school. But as soon as I walk in that door, I'm her peace. Mom,
Right.
it wasn't like that. It wasn't that bad.
Right.
So you can't do nothing but laugh like, yeah, it was bad. No, mom, I know me. I've
Mm.
had that. So it's just, this is my first, I've had one, but this is my first kiddo that has a disability like she has. And I'm telling you, I mean, to have her sit on my lap and just want to lay her head on me, she just have not been paid enough attention to. She just want the love. They just want you to love them. They'll do anything you want them to do. Just show them some type of love and affection. And I mean,
Right.
that's rewarding. That's rewarding for us because we don't get a lot of that, because we get the kids, like Jody said, that smoke weed and they're in trouble, they defiant, they challenge you, and they want, all the time they trying to recreate them another challenge, and you get over that hump and say, what's next? What's next? With these kids, you don't have to look over their shoulder. Dealing with, and if they're doing some, half the time they can't even control it. They don't even know they have done it. You got to treat them like a 5-year-old sometimes. Hey, you can't extend their discipline too long because they're gonna forget why they was being disciplined. So you know what, you know, And I'm just using food. We can't use food, but I'm like, hey, no, we're not getting it today or whatever. That's your reward or whatever reward I have for her. And she's like, Mom, will I be able to go to McDonald's today? Yeah, we'll have Debbie Donuts. You McDonald's, but Debbie Donuts.
Yeah.
So
Yeah.
I just say, am I having Debbie Donald's today? Yeah, Debbie Donald's, because you showed out at school. So and it's funny and it's fun because I know it's crazy. It's fun dealing with her when she did had a bad day at school because she's so confused. She is so confused of why they it wasn't that bad, but you've been
Hold that
tearing up.
mic for me, sir.
Like
Yeah.
I said, we enjoy. I think I enjoy having kids with disabilities in my home. I
Okay.
mean, I really do.
Okay.
I am now that I venture over to that area. I'd rather have them
Oh,
because they love you. They really
okay.
do. They just really want love.
Oh, yeah, I can see that. So, how long are foster kids permitted? I mean, how long are they permitted to stay in your home? I know they said they're supposed to be reintegrated 9 to 12 months. Yeah, supposedly. So, so I just want to know. I mean, what's the longest that you two have had a foster child in your home, Jody? How long is what's the longest?
2.5 years that I had a child in my home. Two and
Wow.
a half years, and he aged out, and he ventured out for a little while, and he got his own apartment, car, and everything, and
Mm-mm.
he got into a little trouble, and he's back living with somebody. So I mean, uh, and it's a learning curve for some of these kids because they're so anxious to get out of foster care because they feel like somebody is telling me what to do all the time. I just want to be free, and they don't know past your home or past anybody's home what it looks like when you're on your own because you're literally on your own. I mean, you got to pay your bills. You can everything is not provided for you. When you come into care, everything is provided for you. Your food, your soap, your toilet paper, your whatever, all your necessities is provided for you. You get to work, somebody got to take you to work, your gas, whatever. Those things are provided. But when you get out there on your own, you have to provide these things for yourself. And I just believe that some kids are not ready to do that, but they're so anxious to get out here to see the world that they're not ready yet.
Yeah.
So
And Debbie, I want to toot your horn because not only do you talk the talk, you walk the walk, and you're going to adopt one of your foster care children, right?
Yeah.
And so,
yep.
what made you decide to do that?
Well, me and her was just talking yesterday about that. Well, I love her like my own anyway, and I always told her, you're gonna always be my kid, and hearing college. And she's been stating to me that, she has she didn't have she didn't say she wanted to be adopted, right? So I never looked at her as to adopt her because she aged out. So I never really thought about adopting her. And because I thought she just didn't, nationality. So I'm like, okay, maybe she doesn't want it. And then she just started telling me that she wanted to change her name, that she doesn't want this identity anymore. She doesn't want her name to follow her into a fresh start. And I just kept listening and kept listening. She going out like, hey, I'm here. I want to be your daughter. And I've always assured her that no matter where you go, you can always come back here. You have a family. And she told me that, she said, I know you always extended that out there, but for me to have to bother you with things that I have going on as an adult. I didn't think that would be fair on you to dump more things on you when you're helping other kids. Gives me, you adopting me gives me a family. I really, I wanted to adopt me, but I didn't know how to say it, and I didn't rejection of it. Wow, I am so sorry that um the language that you was reading from me, as if I wasn't interested in adopting you. I would adopt you a long time ago if I knew you wanted to be adopted. Out of any kid that I've had in my home, she deserves a family, and I wanted to make it where she could always come back, and she don't have to be afraid to come back or embarrassed to come back. I'm mom, them are your sisters and brothers. You knock down these doors because you're going to deal with trauma for your life. You knock down doors, we're going to let you in. And if you needed that safety net there for me to adopt you, then I'm willing to give it to you.
Yeah.
Right.
Jody, I know that every time I have attended events or celebrations, you always have Brandon with you. Always. And he's such a manable young man, and wherever he goes. So I've never seen him, out of character or anything like that. So are you thinking about letting him age out, or what are your feelings about Brandon?
Yeah, so my feelings about Brandon is, I always call him my son, and Brandon has, he doesn't want to be adopted. He wants to be with his family and, and stuff like that. We had talked about that. He wants to age out, but he's not going to age out until he's like 21, though. And after high school, he's going to go to he wants to go to a more Chisholm Life Center, and what they're going to do is like teach him life skills and stuff like that to help him to further his education and life skills. I mean, like he knows how to wash his clothes. He knows the basic stuff, but like getting more intensive cooking, and they take them out on like trips to go show them like employment, to try to help them to see what kind of job they could seek after they get out of school, and where they're willing to hire these types of special needs kids to help them through their life and to help them guide them. A better understanding to let them live a comfortable and quality life.
Yeah. So before I let both of you go, I have one last question to ask, and give some thought to what would either of you do to give any advice to people that are thinking about maybe becoming a foster care provider? What advice would you give them, Debbie?
I would tell them, just if they know anyone that do foster care, to shadow them, and see if that the agency that they're going through can set up some interviews with foster parents, so they can have some idea of what really goes on. Because just sitting there reading stuff in a book and you just reading scenarios, to actually talk to someone that goes through a lot of the events that goes on with the kids when they're escalating, what it looks like, how you support it, and the things you have to do, because and a lot of times you up here, and this is things that I didn't know that I would be doing all this, feel that I would be dealing with kids with mental health issues, juvenile, be getting kids that are in foster care that need a home, kids of a need of a home. So a lot of people close down after a while, like, no, I can't do that. Or they decide to just be ER homes instead of being foster homes. So ER is just go at night and you leave in the morning. And you might get a different kid. There's so many different levels of fostering. And you don't get all those levels when you first come in. So I would expect everybody to ask someone that does foster care, what is the worst thing that you've dealt with, what it looks like, how did you handle the situation? So you can determine whether you want to be a foster parent or not, because it's a lot. It's a lot of sleepless nights. It's a lot of, you have to talking to other people on the phone. Me and Jody, we confide a lot in that, energy, because you hold so much in, because so potential. And I think that I didn't know and understand, and I had to learn a lot. I had to learn along the way. And it wasn't there. But if I could go back, I probably would have, and talked to a few people and asked the questions that that was in week class. I think it's 10 weeks, right, Jody?
Yeah, it's 10 weeks.
Okay.
10 weeks.
Okay, Jody, what would you do?
So my thing with that is you definitely want to ask somebody who's been doing it for a long period of time, because there's not only like the worst thing that could happen or anything, there's allegations that come along with it. And the allegations could be where you stop fostering because a kid lied, or and so you have to be so careful about what you do, what you say, and stuff like that. And it's a lot that goes into that. I mean, you have to really be sure that you're ready to be under scrutiny, under a mirror, or eyeglass, because a magnet glass, because they're looking at you, your caseworker, their caseworker, DCF. I mean, it's a lot of people. They come in your house every month to check on the kid, your caseworker, their caseworker. So it's a lot that goes into fostering. It's not like you just you wake up in the morning and you got to get them to school, take them to appointments. It's a lot that goes into fostering. It's not something that, for the weak heart, because if you don't have the love for the kids, it's gonna show up in your attitude, and people calling you, people asking you questions. You get calls from the school. How are you going to handle that? You get calls from your caseworker. You get calls from, the parents. The parents play a lot of roles in that too. I mean, you may have a parent that's disgruntled, and so it's a lot. It's a lot.
It's a lot. So I said that was going to be the last, but I really want you and Jody, you and Debbie, to kind of, what advice would you give the foster care agencies that contract with DCF? What could they do to make your life as a foster care provider better, easier when it comes to foster care? What can they do?
Be consistent.
That's my answer. It's just they need to really be consistent on whatever they say they're gonna do for these kids, because these kids is just like us. We rely on what they say and just be consistent. Because we have to, regardless if we want to or not, we have to be consistent for the kids. And if we're not consistent, then they looking at us like we crazy. So I want the agency to be just as consistent as I am with these children, is to be consistent with the foster parent as well.
Okay.
No, one thing that I try to do, I try to, their workers, I try to get them to understand you different agencies, but we still a team. But we don't work together efficiently, we're not going to service a kid. You know what kind of kid you put in my home. So I need you to be Johnny on the spot. I need you to work hand in hand with me so we can better service this child. But I also know I'm a doctor. No, I don't have a degree. Okay. For the agencies to listen to us. We need, and when I say more control, sometimes it's so hard because when you're trying to get some things done for the kids, they remind you that they have to say so. You know, that you just a home for a lot of things. We have to say so. We have to call, like traveling. Okay, you say they my children. Why do I have to take these kids to Kansas City? Okay. And the reason why I say that is because I've been denied to take the kids. One kid, I may have 4 kids, but one kid can't cross the state line because you don't want them to. You know, things like that. You want us to have a natural, normal life, right? But with all these stipulations.
Yeah.
You know, you got to give me 15 days this week. You know what? I got a little extra money. Let's go up to Kansas City. But I got you talking about, oh no, you didn't give me enough time. Are you serious? I need them to understand that in order for us to give these kids everything we need more support, we need more understanding, and we need them to trust that we're making the right decision for those kids. And stop talking to the kids.
Good advice. Good advice from both of you. Really. I mean, who couldn't understand that what you're saying is reasonable when it comes to how the system really should work and how they should listen and cooperate and be a team. So yeah, absolutely. Absolutely. Well, Debbie, Jody, I want to thank y'all for being a guest on Seasoned Women Podcast. And this has been very informational and useful, I would think, to a whole lot of people. So thank you again for taking out some time out of your busy schedules to be a guest on my podcast. I really appreciate it.
Thank you.
Thank you, Miss.
Keep doing what you're doing, Miss Mary. Appreciate you. God bless you.
Thank you. Thank you. Much love, y'all.
All
Love
right.
you too.
All right.
Bye-bye.